My name is Dr. Nupur Patel. I am an assistant professor in the Department of Preventive and Restorative Sciences. I'm a maxillofacial prosthodontist. I also am the program director for the Advanced Education Program in Prosthodontics and the Division Chief of Prosthodontics here at Penn Dental Medicine. So, prosthodontists are generally long term members and essential members of an interdisciplinary team focusing on the management of patients with cleft lips or palates from infancy to adulthood. In many scenarios, these patients can vary in their presentation, whether it's a cleft lip alone, or is it a cleft lip and a palate, or a cleft that's limited to soft palate. It can have varying extents of the presentation of this congenital deformity. And so prosthodontists can be involved at different stages of treatment of these patients. The care that prosthodontists can provide to patients with clefts can vary at different stages in the patient's life. So during infancy, prosthodontists and specifically maxillofacial prosthodontists can provide care such as nasoalveolar molding to reduce the severity of the cleft prior to their primary repair surgery. During growing stages in patients that require it, prosthodontists can also provide speech appliances or appliances that can facilitate speech as well as swallowing. And in some cases, provide aesthetic enhancements as well, especially because some of the patients that do have these clefts also have congenitally missing teeth. And when some of these teeth are missing, it impacts the patient's self confidence, especially while they're growing, as well as during their adult life. And so at those stages, prosthodontists can help in rehabilitation of these patients with replacement of teeth, as well as sometimes replacement of associated structures that may be missing. So, like I said, prosthodontists are long-term members of a multidisciplinary care team, and depending on the presentation, our involvement can change. So, at certain stages, if a prosthodontist's care is required, for example, in infancy, with assistance with speech or swallowing, or even with nasoalveolar molding, we can be involved at that stage. Eventually, in their growing years, depending on the extent of the success of repair, or if there are associated missing teeth, we can also be involved in some replacement options during the growing phase. We can also be involved eventually for some type of orthodontic treatment that some of these patients require, especially if they have multiple missing teeth, so that we can guide the growth and positioning of the teeth for future um, support for replacements. So these patients require long term care and intervention. So we are involved and coordinate with different team members of the care team so that we can focus on rehabilitating the patient with the um, best possible kind of speech, swallowing, as well as aesthetics and confidence building for their growth and development. In adulthood, many of these patients then require either maintenance or replacement of some of the restorations that they may have received during their growing period or during their youth. And so, generally, prosthodontists are trained to plan for the future and plan for failure. And so, having a team member that has kind of been involved with the beginning of treatment and knows what the background is, for them to be involved at every stage for maintenance as well as revision care can be beneficial for long term functional rehabilitation for these patients. In contemporary care, It's very important for patients to seek institutions or environments where they can receive a multidisciplinary approach to the care of their cleft patients. The strength of this is that every team member brings diverse expertise. However, the true strength comes from their collaborative approach and their ability to successfully work with each other in gaining the best possible outcome for the patient themselves. For example, prosthodontists are trained to work very closely with speech and language pathologists. We can alter our um, prosthodontic appliances, prosthetic appliances to um, facilitate speech improvement or speech exercises to enhance the patient's speech. Um, we can also alter our prosthetic appliances to facilitate swallowing and obviously also enhance aesthetics. So we can work closely with different team members to give the best possible outcome for the patient. So, parents of patients that have cleft palate or any other types of clefts should seek an interdisciplinary care team from the beginning. So, from the infancy stage, to look out for an environment that can provide team-based approach to the care of their infant. Um, because as I mentioned, prosthodontics can contribute to the care of their infant right from the beginning. If it's necessary, if the other team members, for example, if the surgical team members um, don't see the need for prosthodontic intervention, then we can monitor and provide support when necessary. However, early intervention has generally proven to improve outcomes of primary cleft repair if those patients undergo nasoalveolar molding in the beginning. So it's best for parents to be aware of what a prosthodontist can offer. And this information is something that we're trying to create awareness for in the community so that we can help the patients um, from the very beginning. And this can lead to their improved outcomes for their lifelong development.